Could there be a game changer in the fight against coronavirus from something that comes from within? And there's been a lot of talk about maintaining physical health during the COVID-19 crisis. What about people's mental and emotional health? Those subjects and more coming up. I'm Duke Keith, and this is El Paso Town Square. Welcome back to El Paso Town Square. Speaking now with Carla Alexander of Vitalant. This is the Blood Donation Center through El Paso and Las Cruces, and Carla is the Marketing and Communications Manager for the South Division. And we just got done talking about this. You kind of have a wide swath there when it comes to Vitalant, the area you cover, Carla. Thanks very much for being with us today.
Thank you so much for having me. It's a pleasure to get to talk about this and help people understand.
Well, and what we are talking about here is something that is it has a lot of interesting potentials and things that we can discuss. I know that at this point, as we put it, it is an experimental investigational treatment. What we're talking about, emergency investigational treatment, and this has to do with blood plasma, and it's something that people donate on the daily. It is something that is kind of an accepted thing in healthcare. Obviously, you need blood, you need plasma as well for different kinds of treatments. What you guys are doing with this, though, it's very interesting indeed. And kind of explain to folks what we're talking about here and why this could potentially be something very important.
Absolutely. What we're doing now is collecting what is known as convalescent plasma. And this is plasma that has come from someone who has had and recovered from COVID-19. So they've had the virus, they've been tested, and it's gotten a positive test from a laboratory or their doctor's office saying that they have it, and then they've recovered completely from it. 14 days after the negative test, they are able to come in and donate plasma, and under approval from the Food and Drug Administration, we're allowed to collect that and send it in as an emergency investigational new drug. What they do with that then is give it to someone who currently has COVID, and it provides antibodies available and helps them fight the disease off where they may be struggling to fight it off on their own. So much like other vaccines, that you take the antibody and your body creates, defenses against it. These people who have beat COVID created these antibodies, and that those antibodies are contained in the plasma. So we just draw the plasma from them and then use it to go on and help people who are struggling to recover.
This is very, very interesting stuff. And rather than, say, a vaccine, which is, used to treat healthy people so you don't get sick, this is something that what you're saying is going to be used for patients who are already suffering from COVID-19.
That is absolutely correct. Okay. That is absolutely correct. So they may be, the people that are in ICU, the people who get it and aren't able to fight it off on their own for whatever reason, then they can be given this, and it will provide those antibodies to help them fight it off where they cannot on their own.
Right, and we should point this out, and obviously this is folks who've had coronavirus, so they've recovered from it, and it's only dealing with people who already also have the virus, if it's being given at all, if it's being allowed to be administered. What are the qualifications for people who would like to donate that kind of plasma?
Absolutely. We're asking anyone who has been diagnosed, so they got ill, they went to their doctor, in some form they got a positive test from a lab, and they've gotten better, they've gone back, and they've gotten a negative from a test then. All they have to do is be negative on it, and for at least 14 days. Okay. That ensures that they're recovered, that they're not going to relapse, that they're in a healthy state to donate the plasma. Of course, there are other criteria that they will ask some questions about that sort of go along the same lines as blood donation. There are certain criteria, but we do have a form and a phone number that if they feel like they qualify, if they feel like they want to try to help, that they can reach out to those.
Oh, could you? Yeah, please do express. Let us know what those are. Where can people get in touch if obviously they're not that many people, but if you do have it, and if you know somebody who does, and you want to pass this along, where can people call or text or email?
Absolutely. They can email Vitalent, and I'm going to spell that. It's V as in Victor, ITALANT .org. I'm sorry, Vitalent.org at COVID free. COVIDFREE. So if they go to Vitalent.org/COVID free, it will take them to the form. They can fill out that information, and we will be able to, call. They'll call them. They'll do some inquiries with them over the phone, or they can call 866-287-5762. And that someone will answer at that number and take all their information down and help them understand whether they're available or not.
Right, and this is, it's the first step, obviously, and then you have to have, I'm sure, physician's notes and referrals and so forth, and then I believe that there are some other steps that they're going to have to go through before you get to that point, but I would imagine anybody who's been through it, especially if you had a serious bout and, maybe you suffered some of the worst effects that we've heard, you would be eager to help out when and where you can.
I'm telling you, we've had several people. I'm the marketing manager from Lubbock down to the Rio Grande Valley, and we've had several in West Texas. We've had several in the Valley, several in New Mexico. We had our first one in El Paso today.
Outstanding.
So it took a minute for us. Of course, El Paso's been a little slow, running up higher with the numbers, so we expect for that to increase. But we really encourage anyone. It is truly a chance to make a difference in this pandemic in a way that no one else can.
And it's interesting because we've heard about vaccines and how it might be a year to a year and a half before anybody comes up with an effective inoculation against this, and how hit and miss that can be. And obviously there's testing, and it has to receive FDA approval and go through all of that process. But this is something that is available for people right now. Again, it is experimental. I am thinking that the jury's kind of still out in many respects, but it's also approved because it's plasma. It's not, you're not coming up with a new drug or something. You're using what people already have within themselves.
Exactly. That is, I couldn't have said it better. You couldn't have explained it any better. It's an antibody in the plasma, and it's not like something that, like you had mentioned, it's not something that can hurt them. It's something that is going to help them. So.
Right. And again, it's not being provided. This is not for people it's not an inoculation for people who don't have it so they don't get it. It's for people who do have it and are dealing with some of the worst, symptoms and circumstances with it.
Absolutely. Those people who are in ICU, who have already compromised immune systems, the ones that are at the highest risk for the worst outcome. So that's the people you can be helping, and they've used it, and they've had some excellent outcomes with it.
That is tremendous to hear, really, honestly. And wow. Obviously the inoculation is going to be very important when and if it ever comes, because nobody wants to get it. And I'm sure that, we can talk about testing and how everybody gets back to work, but this is possibly a sea change. I mean, just in dealing with over the last 2 months, everything we've heard from January on has been just worse and worse and worse news.
Absolutely.
This is very different. This is a sea
yes,
change.
And I don't want to fail to mention that one patient's donations can actually help several patients. So when you go in and you donate a pint of plasma, which is what you would donate, that will be broken up and could potentially save several lives.
That's just incredible stuff, and wonderful to hear. Vitalent is the largest private blood provider in the United States. This is the largest independent blood provider in the United States. Obviously, you talk about the American Red Cross, but Vitalant does such great work here in El Paso and Las Cruces and throughout the Southwest, Albuquerque, and as you point out, your whole area, all the way down to the Rio Grande Valley.
Yep.
You guys are out there and kind of on the front lines of this. Talk about blood donation right now, because this is also interesting because a lot of the elective surgeries have kind of gone down. Things have changed a little bit for you guys in kind of your bread and butter, so to speak.
Absolutely. It's completely different than anything that's ever happened in the blood industry before. Because as I'm sure everyone knows, we're always trying to get people to come donate. It's not always the easiest thing to get people to do due to just we're fighting people for their time, and people have fear of needles and various things. Well, when the government came and told the hospitals they couldn't do anything except emergent surgeries and treating cancer patients, obviously the blood usage went down substantially, and that's been a unique situation for us. So what we're asking people to do is call and make an appointment. And then right now we're just talking for regular blood donation, platelet donation, plasma donation if you haven't had COVID. But if they call and make an appointment, they can still be helping so much, because as they crank back up on surgeries, which I think in a couple of days they're going to lift those restrictions, all of a sudden blood is going to be needed, and we're going to really need people to step up and come in and help a patient out in the midst of all of this.
I know we've done a lot here at Townsquare in El Paso, KLAQ, KISS FM, 600 ESPN El Paso, here with our radio group, trying to urge people to go out and give blood, and blood drives, and Harley Davidsons were giving away motorcycles and all this other stuff. This is the first time I can ever recall where you're saying, wait a minute, we don't want all the stuff that we've got to expire. We can't use the bad blood. Wait just a minute and don't come in right now. Just make sure you set your appointment, correct?
Exactly. We always want to be good stewards. It's such a precious gift, and we are so appreciative of the people who take the time to come in and donate. We always want to be good stewards of that generous gift. So right now we're just managing it. So some people are getting a little aggravated because they're calling in and we're making patient appointments into June and July. But that's just so that we are sure when we take your blood, it will be used to the maximum benefit.
Speaking again with Carla Alexander, she is Vitalant's Marketing and Communications Manager for the South region, which extends all the way down into the Rio Grande Valley and from El Paso and a little bit north of here as well. But Carla, this is, the main news of this, that if you've suffered COVID-19 and you have recovered fully from it, that your blood plasma might be able to be used to help save people who are suffering from coronavirus right now, and again, there's no guarantee. We shouldn't say save necessarily, but help create something that might help along the way. And it really is a sea change. It's huge.
Absolutely. And it could save. It is that much, people are perishing, unfortunately, from this.
Yes.
So it is a situation where it could help them get better, but it could, in some cases, literally save a life.
Just amazing. And it's been approved by the FDA as obviously, it's kind of an all hands on deck throughout the healthcare industry, and you guys are included in that. But what an incredible role for, I remember the slogan, "Find the hero in you." That's the way you guys, right? That is the Vitalant slogan. I cannot think of any more heroic action than somebody who's already suffered and recovered from this virus to help those who are suffering from it right now. Those are some true heroes out there.
Absolutely.
Well, Carla, we appreciate you taking time with us. And once again, if once the restrictions are lifted, I imagine it's going to be business as usual for Vitalant, and we'll be back to doing the blood drives and giving away Harley Davidsons when we can. But we certainly appreciate you being with us today and expressing this news, which is so incredibly important. And hopefully we're all back doing blood donations soon enough and all together to do it. That would be a wonderful thing.
I hope it's in time for the July Harley blood drive.
That's right. That's the big one. They're at Barnett Harley Davidson here in El Paso and in Las Cruces as well. And once again, Carla Alexander with us and with you. And Carla, if you wouldn't mind, tell folks if they have suffered and made their way out the other side of COVID-19 and you are interested in donating plasma, how can they get in touch with Vitalant to be a part of something that potentially could change a lot for sufferers of coronavirus right now?
Absolutely. They can go to our website, which is vitalant.org, VITALANT.org /COVID free. Or they can call 866-287-5762.
Carla, we certainly appreciate your time. All the best to you and yours. And boy, it's really big news. Thank you for being here to tell us about it.
We appreciate your support always. It means so much to the community of El Paso and Las Cruces for you guys to be such a good support for us.
Welcome back to El Paso Town Square. I'm Duke Keith, as we continue to focus on the coronavirus pandemic and what El Paso and the Borderland region can do and is doing to deal with the crisis. We are very pleased to have Fernando Muñiz, he's a licensed professional counselor, with us as we discuss mental and emotional health, which is, I would imagine, Fernando, something that's a bit overlooked when you look at this whole crisis. Everybody's talking about, how do you get groceries? How are you dealing with your job? But this is, it's all of a piece, isn't it? It's something that it isn't necessarily thought about until you get to the point where you kind of understand, hey, maybe we all need to talk about this a little bit. Do you see that?
I agree with that. I think sometimes we do overlook, the emotional, psychological side of a crisis situation like this, because it for some people it is an ongoing crisis. It isn't a one-time event. We've been going through this for almost a month, and it does take a toll on some people. For some people, it may actually be a moment of relaxation also. But definitely people are being affected by this psychologically. And I think that the president did have a meeting with a mental health specialist. So they have kind of already discussed that, which I think was a very good thing to do.
I think it's going to be very important, especially if there's any kind of recovery at all. I remember hearing about the SARS epidemic in China and in Asia. Specifically, people got agoraphobia. They were afraid to go out of their houses after it was all over. And I imagine there's going to be a lot of that everywhere, including El Paso.
I think there will be a lot of hesitation, fear, of going to establishments such as bars or, getting out to the entertainment side. So I think there will be hesitation. I think what's important is for people to understand the facts and to follow CDC guidelines and guidelines from the state, local and federal authorities. I think that's very important. I think that would do some of the fears. The best way to deal with fear is by dealing in facts as best as you can. And if you already suffer anxiety or tend to suffer those type of issues, it's always best to work on fact-based information.
Yeah, I would agree with that, and we're seeing a lot of folks responding in fear, and that's just sometimes that knee-jerk fear response is the worst thing ever. And there are ways to find out the facts. The fact is, even though there are probably lots of different ways that health professionals are coming at this, one of the proven methods in trying to get rid of this virus, or at least get past it, is the social distancing. And that's probably hard from an emotional standpoint, but it's the most effective way, that flattening the curve, and it's been proven around the world to be the most effective method of moving past the disease itself.
Correct. It is proving to be the most effective, but it can take a toll on certain people that may suffer depression. What's interesting, though, in my practice, what I'm seeing, and this is only anecdotal, there's no research to this fact. What I'm seeing is a lot of anxiety patients are actually doing very well.
Really?
Because a lot of them basically tell me, I've already been through this in my mind. So, it seems that they're doing well. One of the things I am seeing, though, is family stress. The kids being at home a lot, parents having to deal with their children. But at the same time, I'm seeing a lot of calmness because the stresses of being in school, dealing with friends, and the social stressors aren't there. So there's actually some people that are actually adapting fairly well to it.
That is an amazing thing to hear. But you say it, and it makes perfect sense. And let me ask you, and obviously, we talked a little bit before we started. This is unprecedented, I would imagine, for you and anybody in your field to have to deal with. It's unprecedented for everybody. I don't think anybody's ever dealt with anything quite like this, although you did have one comparison a little bit, and that was to 9/11 and dealing with people's fear right after that. You've been around and doing this for close to 30 years now, so you were around doing this on 9/11, and I imagine this is something that you've seen a little bit of before.
Yes, there's some comparison. But however, I think even though that was a very tragic event, it was to some extent, shorter. This has been an ongoing crisis for, over a month. So, 'cause this is obviously taking more of a toll on people. And I think the longer it lasts, the more toll we're going to see. The concerns that we have, of course, an increase in family violence, an increase in even suicides, those are the things that we have to be looking out for in a situation like this.
I think that's very well said. I know that obviously it's a lot of stress on a lot of people, and I know that there are some folks we deal with, the CASA, court-appointed special advocates, that where after it's done, they really expect they're looking for people to volunteer to help out because the domestic violence situation is, obviously people are there together. And sometimes in those kinds of situations, that's a bad thing. Are you dealing obviously you can't get into details, but are you dealing with that professionally?
I'm not dealing with that at this time. I do work with some foster children. However, because they're already in the system, they seem to do really well, and they do have caseworkers that are constantly keeping in touch with them. I think another aspect that we haven't looked at is maybe a lot of business owners that might be going through a lot of stress, and there could be some dangers to some of them if they're not connected to family or they're not talking to people about the stresses they're experiencing. Because I can tell you that this is this is unprecedented. For at one moment you have a business, the next moment you have to close, and the toll it takes on them, on business owners, having to lay off people and being concerned for families that they are in a sense responsible for. And so I would tell people to be aware of that side too, the business people, that what they're experiencing.
Absolutely, and I think it's going to be stressful for any individual who has to deal with that. But obviously, if you have a lot of people who are counting on you. If you're in any kind of situation like that, that is extra pressure. Do you deal? How much do you think you're going to have to deal with, not just individuals, but maybe businesses as a whole? In your profession, do you deal with those kinds of situations on a corporate or a business-like basis, where you're seeing people from an entire, say, a restaurant or an office or something like that?
What I do is I do what's called employee assistance program counseling. So yes, I do deal with businesses, healthcare workers, military, and I do also do crisis intervention in different businesses for different programs. For example, when the horrific situation happened on August last year, the shootings in El Paso.
Right.
I was called in to do crisis intervention at several businesses at the mall, with some other employees. We're probably going to be seeing an increase. I've been seeing a lot of increase in not only business side, but also government employees.
I would imagine so, and especially if you've got first responders and those folks who, it's already a stressful job as it is, and then you throw in having to deal with not knowing, maybe if you're an EMT or something, what you're dealing with when you show up at somebody's house. That's That I can absolutely see.
Correct.
What are your thoughts on the social distancing? You mentioned that some of your patients have been dealing quite well with it, but then I imagine there are others that aren't. Do you have advice for families and people in general on how to deal with social distancing guidelines and some of the rules and regulations we're under here in El Paso?
I think what I'm telling my clients and patients is that this is a time that you can kind of step back and reflect on yourself, reflect on ways to self-improve. It's sort of like everybody got a timeout. Hey, timeout. Let's sit down and think about our lives. Think about the things we would like to accomplish. Think about the things that we'd like to improve in ourselves. What I tell my families is think about the time of reconnecting with your children, reconnecting with your spouse, creating things like family time. If you're able to walk around your neighborhood safely, walk around your neighborhood, get in touch with your children, get in touch with families. For those that maybe don't have families, I guess if we have any advantage of this happening at this time in our history is that we have social media, we have great communication tools, we have Skype, we have Zoom, we have all these technologies that can, in some sense, keep us connected to others. So those are some of the recommendations that we're making. In fact, there's been an increase in telehealth for us practitioners, where we're doing a lot of video counseling, telephone counseling, and so, like I tell people, if this was going to happen anytime in history, wow, how lucky are we that we have these technologies to be able to do this?
We are blessed indeed, absolutely. And is there, I guess, any specific advice? Obviously, you got families and ways to stay connected to people, but what about those folks who might be really isolated, especially for older folks who are out there, seniors who are kind of cut off from their families and might not know how to use Zoom or some other piece of technology? What are your suggestions, both for those individuals and maybe the families who know that they have, they've got to go take care of grandma a little bit, even though they've got to stay socially distant?
And, that's interesting. I think that, again, they may not have the ability, but, what's interesting is in some of the geriatric patients that I have worked with, a lot of them are very much in touch with technologies. But however, for those that aren't, of course, there's telephone conversations, calling in once or twice a day to talk to the elders, coach your elders to also talk to you and communicate, because a lot of times, specifically in the El Paso culture, sometimes the Hispanic culture, sometimes, they don't want to be a bother to others, but we want to encourage them to call us, to talk to us. We want to encourage them to exercise, to walk in their room, in their house if they can. You can come up with creative ideas like, call them, hey, I'm going to pass by your house. Let's talk through the window. There's so many wonderful, fantastic ways of being creative with people. The other thing that I wanted to point out is that it's also very important that we're exercising. That those are things to help you deal with the stressors of social isolation. Exercise at home. You don't need that much room to exercise. There's so many creative ways to exercise, and I think that's very important to do that.
Speaking with Fernando Muñiz, licensed professional counselor, board certified here in El Paso, Texas, and just talking about mental and emotional health. I know that as kind of someone who deals with crises professionally, obviously, when we all kind of get back together, when and if things improve over the next number of months, however long it takes, there will be a time when we all kind of come back together again. I imagine that the challenge will be immense for people in your profession, and really for everybody in all walks of life. But the way you express things, and what you're saying is that it's really kind of a one step at a time process to kind of get back into it, isn't it?
It very much is. It's about being patient with yourself. It's about being aware of your emotional state. What am I feeling? What am I experiencing? Taking your time to get back to the normalcy, whatever the new normal will be for us. Also, if you need help, don't be afraid to ask for it. There's a stigma of asking for help. ask for help if you need it. There's plenty of help in this community. Paso has a great mental health system in that there's help available in the town. So, make sure that you do, if you need it, look for help.
And one of the ways to do that would be to call licensed professional counselors like Fernando Muñiz. Do you mind giving out an email or ways for people to get in touch with you in your office?
My office number is 598-2190, and they just can call in. And I also recommend that if you have insurance, Medicaid, private insurance, to contact your insurance companies, and they can also give you they can connect you with counselors and mental health professionals in this community. So doing that, there's also, you can find us on the internet, Hemispheres Behavioral Services. That's the name of our company. You can call us, and we're here to help.
Outstanding. Fernando Muñiz, licensed professional counselor, board certified, LPC, and we certainly appreciate your time. Kind of an under-discussed element of this, I think, but ultimately very, very important. El Paso's mental and emotional health in dealing with the coronavirus and the COVID-19 pandemic. Mr. Muñiz, we appreciate your time. Thank you very much for being with us today.
Thank you very much. I appreciate it.
Not only a thank you to Fernando Muñiz, but also to Carla Alexander of Vitalant. Some possibly exciting news about the use of blood plasma in treating COVID-19 patients. I think we all can look forward to hearing plenty more on this story as it develops. And our thanks to you for listening. And here's looking forward to next week. Until then, I'm Duke Keith. So long, everybody. Be safe, be well.